this is what's happening now. This lady, Vanessa, Vanessa, sorry about that. Vanessa died today at the COVID-19 hospital. You should hear some of you should listen to what I don't know. This is heartbreaking. Vanessa Maynard, this is heartbreaking because it is something that we have been saying to you guys right here on 107.1 FM that it exists, right? Neglect of these patients at the COVID-19 hospital. Lots and lots of neglects. But let us bring her relatives on, man. This is heartbreaking. You guys have to hear it. You guys really do have to hear what is happening at that hospital. Good evening to you both. Good
Good
evening.
Good evening,
evening.
Mark. Thank you for having us on your platform.
We have Kizzy and we have Wendy. Um, Good evening to you both. I know who explain to our listeners who was Miss Maynard, Vanessa Maynard to you guys.
She was my aunt and my mom's sister.
Okay, Wendy, when you heard the news of your sister being in the COVID-19 hospital, being admitted, uh, what was your initial reaction being in that COVID-19 hospital?
Well, um, I didn't have any bad thing, or I didn't know anything bad about the hospital until she got there. So I was going step by step with what she was telling us, that she's admitted, she's seen the doctor, she's going to be treated, and then after she was told that she was going to be treated, everything went haywire. She never got any medication for about 12 hours. Then after that, they said they were going to give her antibiotics. She never got it. Everything was staggering and they were dragging their foot. Then eventually they said she was going to have a CT scan. We paid for it and it never happened from since Friday,
And
Saturday.
a CT scan, they don't have a CT scan machine at that hospital. They don't have that. How much money did you guys pay for that CT scan?
So we actually paid 60,000 Guyanese dollars. And if I can just elaborate a little bit on what my mom was touching on, just to kind of shed some light on the incompetence and the inept performance or lack thereof of this facility. There were so many discrepancies with her treatment. There was no comprehensive plan of care outlined. They were poor communicators with the family. Um, you know, we were told that the doctor wrote an order for the CT scan. Then there were three instances where she was scheduled to go get the CT scan. However, we later found out that the charge nurse was not even aware that a doctor's order was written for her to get a CT scan. So, as far as documenting, medical records and keeping things in order, there seems to be a lack of that. There seems to be a lack of communication between the doctors and the nurses, and there also seems to be a lack of communication with the hospital staff and the ambulance staff because this past Saturday was the first time that she was scheduled to leave the Lilienthal Hospital to go to Mercy Hospital to get the CT scan. She was prepped and taken into the yard, and she was left there for the most part unattended. And then they told her, "Oh, we're so sorry. You're not going to be transported to Mercy Hospital because the ambulance has left." Okay? Let's keep in mind that she was NPO the day before, which is nothing by mouth. We should also take into consideration that my auntie is diabetic. And so naturally, her insulin levels were like,
All over.
all over the place. So that was the first incident. Then on Monday again, they scheduled her they allegedly scheduled her to be picked up from Lilienthal to be transferred to Mercy for the CT scan.
Mhm.
Again, the same incident occurred. They told her that the ambulance had left. And then on Tuesday, that was the third time that they scheduled her to be picked up and transferred. And they told her that the oxygen tank only had 8 liters instead of 10 liters of oxygen. And so, therefore, they would be unable to transport her from hospital to hospital to get the CT scan. So, we're still puzzled because we're trying to figure out if a doctor's order was written for a CT scan. My family member, who's my aunt, I'll just say family member, was directed to go to Mercy Hospital to pay for the CT scan, bring that receipt back to the Lillian Doll Hospital, but yet the charge nurse claims that she was unaware that a doctor's order was written. So, with that discrepancy there with the CT scan having to pay the $60,000, we're so unclear as to what truly transpired there. May I continue, or would you like me to?
Yeah, we're listening. I want to get to something, and thank you so much for explaining this, Gizzy, and thank you, Wendy, as well. We have some other family members, Kenesha and Melissa, that are on. But before we get to them, she pleaded with her relatives and everybody, and she talked about the conditions and the treatment there. I want to go to one of those messages that I got through one of the relatives as to her last couple hours. This is one of the messages that I got, and you guys can listen and tell me if you're familiar with this message and what are your thoughts of what she's saying.
With treatment, and I ordered them home no treatment. I just tell you guys to come in last night. Today night, the treatment doctor I review my child and then gonna start treatment from the whole my life was no treatment.
She basically, Miss Maynard, Vanessa Maynard, is basically sent a message to her relatives, sent a message to you guys, saying there has been no treatment, none whatsoever. I don't know. That's heartbreaking. Let's get to your mom, Wendy. Wendy, what are your thoughts? What's going through your mind when you heard your sister pleading, crying out for help, and she's saying that the doctors at the COVID-19 hospital did not treat her? Your take.
I was appalled. Our hands were tied. No one can visit. No one can get a phone call into the hospital. We were like totally shut out. It was like a prison. We can't get any communication. We can't get any help to her. So immediately, we were all taken aback. We couldn't deal with it. We were just relying on whatever information she gave us, and we were talking among ourselves, but we couldn't do anything. Our hands were totally tied.
And if I can interject right there, that voice note. So let me preface this by saying to everybody that's listening, my aunt is a registered nurse, and she's quite skilled and experienced registered nurse. So from the inception of her admission, she was very observant, and she was alert and oriented times 3. She was cognitively aware of everything that was going on. And so as a competent and skilled and talented nurse, she knew what to look for. And so I think this was a great thing that she did as far as keeping us updated with the voice notes and keeping us, breast by breast aware of everything that was happening. She was observing all of the inept treatment and lack thereof. And so she was just recording that and letting us know what was happening. And so that voice note that you guys heard was actually upon her initial admission to Lillian Doll. Let me share with everybody that when she went to Georgetown Hospital, They had her there for several hours. They did the labs. That clinical documentation was not appropriately transferred over to Lillian Dahl until like late into the night. And so when she arrived at Lillian Dahl, she received no treatment at all. And so as a nurse, understanding that she should have been rendered some medical treatment, that led her to send us that voice note. And so that is what you guys heard through slight respiratory distress, because as you can determine in the voice note, she's already gasping for air, and there's some, some compromised circumstances there with her lungs already.
Kizzy, thank you so much. I want to go to another voicemail that I got. Our executive producer has just dispatched this to us. Here goes.
Again, I know 2 ambulance came, but they said, no, I'm not right. I want to go to the hospital and do what I do. What do you have to do? CT scan. CT scan? Yes. Just now, right? Just now, all the time it's just now. What do you call it? Huh? You do? I talked to my sister. You're in no trouble, don't worry. I just explaining to them what's going on. Oh. So, I'm down in the yard again. I 2 ambulances that came. It wasn't to go to Morrissey to carry me. So I have to wait on the right ambulance. The COVID ambulance gotta come for me. So I'm here in the yard waiting. But the cool breeze is so nice. There. Just overlooking the Atlantic Ocean, the seaworld. So I'm relaxing here. And thank God for the saturate the oximeter. So for at least see if my oxygen don't drop me.
I want to say that this is indeed heartbreaking. And those people who are running the country right now, those people, I hope they're watching. I hope they're listening on the ground via the station 107.1 FM. This is embarrassing. This is heartbreaking. This is disgraceful. No one should have to suffer. No one should have to suffer like that. And there's so many persons at the COVID-19 hospital who are suffering, who have died, who should not have died. And now, look, I am not going to paint all of the nurses and doctors with the same brush at all. But I blame the regime. I blame the government, the installed regime of Guyana. Let's get to another one of the relatives. I see there's a Mel on. Good evening to you, Mel. How are you?
Hello.
Hi, good evening. How are you?
Good evening, Mark.
Yeah, if you can speak up a little, I know under the circumstances, but you heard your aunt crying out for help. They kept promising her that the COVID-19 ambulance will take her to get a CT scan. Hours and hours and hours and hours they kept her waiting. What is your take when you heard her voice in that voice note, crying for help?
Mark, it was very devastating because on Friday, I don't know if you want me to go, but on Friday, this is last Friday, the doctor ordered a CT scan because her heart rate was increasing. And so he, he suspected a blood clot. So he ordered the CT scan, and he asked if we were going to pay for it. I just want to go over this quickly.
Sure.
And yeah, so she was scheduled for the CT scan the Saturday. Okay. Oh, before that, yes, he asked if we were going to pay for it. This was the Friday, and we said yes, of course, we're going to pay for it today so that she can get it done today, which was last Friday. And he was like, "Oh, no, this thing does not work like this. We have to sanitize the machine and all the equipments and everything before we get the patient, before we transfer them." So she'll have to do it tomorrow, which was the next day. So I'm saying from since Saturday, um, Monday, Tuesday, a blood clot or a suspected blood clot is an emergency because a blood clot can be deadly, Mark. Okay? And they did not treat it as an emergency. Okay, if there's any doctors or nurses listening right now, they can back me up. A blood clot is always treated as an emergency, and they did not treat it as an emergency. They just didn't care.
They just didn't give a damn.
Yeah.
And
Yes.
that's it. That's putting it bluntly. I can just imagine the pains that you guys are going through right now.
Yeah.
And others who have relatives in there, others who have lost their loved ones from in there. Shame on the installed PPP regime. Shame on those vagabonds. Wendy, you heard your sister, she's crying out and all these sort of things. I've heard of other stories where it is actually crowded in there and people are neglected and all these sort of things. They have an oxygen, what is it, an oxygen tank that is not even being used. And people those patients want an oxygen mask. They just don't have these things there. What is your take, Wendy, when you read and you hear about these things?
The oxygen tank that you're seeing there, they brought it for her to go to Mercy Hospital.
Mm-hmm.
But she was on 10 liters, and that oxygen tank only has 8 liters. So when they put her on it, her saturation was dropping, and she was not stable, so they couldn't move. She couldn't move, so they call it off. The hospital doesn't even have an oxygen tank with the capacity to take her for the test and bring her back. So, it was called off again, and that caused everything to ricochet. She didn't get the test. The doctor never get the results, and she just keeps declining. And they're there watching her firsthand, and nobody's doing anything.
You know, Wendy, thank you for that bit of information. $60,000, $60,000+ for a CT scan. Come on. That place almost, I mean, a lot of patients I've heard, they had to have had a CT scan. So in order to get that, they have to wait to go to Mercy or wherever. They have to wait on the COVID-19 ambulance if ever it gets there. Again, a CT scan machine not there. I don't know what's happening. But have you guys been refunded? No, she hasn't got the CT scan. She died because of their negligence.
Well, she died today, and her daughter is going to take care of all those things in the days to come.
I think her daughter is Kenesha.
Yes.
Sorry, Kenesha. Good evening. How are you? Welcome to the program.
Good evening.
My condolences to you and your entire family. And I say this on behalf of the thousands of people who are listening and watching right now. I mean, it's so unfair to ask you how are you feeling right now, but exactly how are you feeling, knowing that your mom documented almost everything. She sent out the voice notes. She was crying out for help. How are you feeling?
Well, I am angry. I am disappointed. I don't think I can find enough words to describe how I am feeling because I was talking to her every day. Sometimes I would call, sometimes I would video chat with her. She would send voice notes to me and so on. Sometimes I'm on the phone and I'm hearing what is going on. For instance, I believe it was the last day. If it wasn't the Tuesday, it was the Monday when she was supposed to do the CT scan. She asked the doctor because she started prepping. I said, "Mommy, you need to prep early. Let them see. Keep asking them. Keep asking them." I even sent in money so that she can give them $1,000, a little something so they can help her.
Wait a minute. Wait a minute.
Yes.
Your mom is in the COVID-19 hospital.
Yeah.
Need help. And you have to send in money to bribe people?
Yes, because when the nurse passed in and she said, nurse, I want to use the toilet or something. They're ignoring her. One nurse, I think it was me and Melissa on the call, when the nurse looked in, like she jumped when she heard nurse, she looked in and she catch herself that it was a patient, and she turned to another nurse and they laughed and walked away. Mommy said, watch the boy. And I said, Mom, you should have had me on video. We were in a call. And anyway, she would even have something. She asked one of them to hot up the soup for her because she can't drink the cold soup. When they bring it, it's cold. And the nurse said that they are on staff and they don't have time to do that. It's so much. Even like to take her to the washroom, sometimes she would not even. She said she was afraid to drink a lot of water because she needed to go to the washroom. At that time, they said they hadn't any bed pans available for her. There was a few days after then is when they got the bed pan for her, and then during the day they removed the what do you call the curtains, so she was not able to use it. She was uncomfortable. She was right by the door, and she would have to ask them to take her there. Well, one attendee she offered to pay to use the washroom, but he said no, and he took her. But another attendee actually took money to hot up food for her. Like you gotta bribe them for them to do stuff. She was even ashamed. She said, "Oh gosh, Kanisha, I was so embarrassed today because I used the bedpan and it was so full." She was asking them to empty it since the day before. And the nurse was just saying, just now, just now, just now, just now. And she said she used it and it overflowed. And she got up and she took some tissue and sop it up and so on. And she asked the nurse to kindly remove it. And it took a while till the doctor came in, and the doctor said, "Man, your urine is too concentrated." She said, "I'm afraid to drink the water because I'll have to use the toilet." And these nurses, man, they're not emptying the bedpan. And the doctor said, "Okay, look, this nurse is going to do it for you." And they did it. It was crazy and it was hard. And then sometimes you have to be strong for her. It was ridiculous. The last day, oh my gosh, the last day I started speaking and I just forgot. When she needed to go do the CT scan, they said that it was on she required 10 liters of oxygen, and the maximum on the small tank was 8 liters. So she couldn't go. So when she called and she told me, I said, "Ma'am, but what about using two oxygen?" Because before they had her on the cannula and the ventilator mask. I said, "What about that?" She said, "Oh, she didn't think about that." So she told whoever it was in the room at that time, I don't know if it was a doctor or a nurse, and the person responded saying they don't have extra oxygen tank. And she's like, "Wow, in this big hospital?" It was ridiculous.
So sad. This is the condition, the ICU. This is the male section of the COVID-19 hospital. Look at the conditions. Look, I must apologize for these photographs. It's heartbreaking. Kizzy,
Yes.
what do you want to say? What message do you want to send out to those who are running the COVID-19 hospital, or even the Minister of Health in Guyana, and by extension, the entire install regime? What is your message?
You guys got to do better, period. The conditions are paltry, and it's totally unbelievable when you hear the accounts of the things that my aunt went through. And this just seems so ominous now, but it's almost like she made these voice notes because she probably felt she wasn't going to make it out of there. And she felt that she needed to advocate not only for herself, but all of the other patients that were in there struggling and going through this with her. And that in itself, it's sad and poetic at the same time. And my hope and my wish is that this live stream is able to transcend and reach a lot of people. And we're out here advocating for my aunt, and my mom is advocating for her sister, and Kanisha is advocating for her mom. But ultimately, we don't want this to happen to any other family members, right? Nobody else should have to go through what we're going through right now. My aunt's death was utterly and completely unnecessary, and it was preventable. And so I think ultimately we're asking for better healthcare in Guyana. And that starts with the Minister of Health. It starts with all of the healthcare facilities. It starts with having doctors and nurses aides that are skilled and competent to do the job. We want to talk about making sure that these hospitals and these medical facilities are well staffed, they're well equipped to handle and facilitate all of the medical conditions that patients present with. We also want to make sure and ensure that going forward, there are comprehensive care plans that are outlined for the patient's care. We can't have, inept processes in place and treatment and care are delayed when it comes to somebody's health and their livelihood. So I'm hoping that our story and our message will transcend and it'll touch the heart of the people that are in charge, the power players and the decision makers, and hopefully change will come when it comes to the healthcare industry in Guyana.
Wow. Your aunt spoke of a couple hours before she died. She said something about she's getting some nice ocean breeze and so forth and so on. I guess she was just enjoying what we're living right now.
That statement, in retrospect, it just feels so ominous that she said that.
Yep.
So that statement will resonate with me every time I think of her in her last days. The fact that she said, oh, the ambulance got canceled again,
Yep.
but I'm out here in the yard and I'm getting this cool sea breeze on my skin.
Let's hear this here. I know. Let's get back to something else.
She come and she took RBS, and she said it's 216. And she come back and she tell me that they will come insulin. Then when she asked me do I eat for the day, she give me 6 units of insulin. They should have done drunk low, with nothing to eat. And they turn off the light and on. So then my little fella they give me no treatment or nothing, right? Give the medication, the rabbit, or medication and drink it. But my stomach empty. So they don't order nothing for you. So just insulin, turn off the lights when she's done. Prayers are working.
Turn off the light and gone. Prayers. Let's continue. More of your.
Our doctor just come and he was not looking after me. Put on back the light and he take out the oxygen and he assessed the situation. He asked me if I could walk. I said I could try. He said try, and I walked from the bed to the corridor and come back without feeling it, or without nobody holding me up. I walked by myself, but the oxygen saturation, it dropped to 84. So, I tell you, I suddenly start trembling because I think it's because of the insulin. And I eat nothing since medicine. I asked me if I want some tea or porridge, and I said I want some tea, so we got to get some tea for a drink. He's not going. He seems to be okay.
Oh, Father, this is horrible. Frank Anthony, shame on you guys. Shame on you guys. Irfan Ali, I don't know what's happening with you guys, but shame. Lots of people died who should not have died because of the recklessness of the install regime. Let's get to closing remarks. Kenisha, what message do you have? I know your mom passed away. You don't want her death to go in vain. You want to save lives right there at the COVID-19 hospital and maybe other places. Your closing remarks, Kenisha. And mind you, Kenisha is the daughter of the late Vanessa Maynard. Go ahead, Kenisha.
Hi. So I think the Minister of Health really needs to do better. He really needs to do better because even when I was asking the doctor when they were updating me, why it is that she was not able to do this or why it is she was not able to do that, they all said one thing. They're understaffed. They said that it is 7 nurses and 4 doctors, so 7 to 5 patients upstairs. So if it is that you don't have staff, why are you locking them out? Why are you allowing that to happen? It's just like just rethinking about it. Oh, it's just crazy. Just now you played that voice note with the incident, and I even remembered one morning she told me that she finally got some hot tea. And then when she drank it, it had sugar. And she said she's not taking it because her RBS finally was the normal range for a diabetic, and she did not want it to increase because when it increased, they just go and they pump her with insulin, and she already had an also a abscess on her foot also that they were treating, so that would have made it worse. But her being a nurse, she knew not to take it. What about persons that don't have that medical knowledge? What happens to them?
Wow, this is so sad. Look at the situation in the hospital. Just look at the hospital. Look at the condition. Billions and billions of dollars into a dying sugar industry. No profit, no nothing. And people are dying. People are infected at a high rate, COVID-19 in Guyana. And the PPP regime doesn't give a damn. Look at the condition of this hospital. Just take a look, guys. Look around. A CT machine, they don't have that. Patients have to pay $65,000, $70,000 just to have a CT scan at another hospital, waiting for a COVID-19 ambulance. Look at what is happening. Yet every day, you turn the pages of the newspaper, and you're hearing something about oil-rich country. We are an oil-rich country. They got billions of dollars. Just today, you read in the newspapers, you've read in the newspapers, another oil discovery. Oil, 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 oil. And look what's happening. Look what's happening in the hospital. Look at what is happening. Oxygen tank. People dying. I don't know, man. I just don't know. I want Frank Anthony, I want them to hear this here again before we go. I want them to hear it.
I'm down in the yard again, and no 2 ambulance came, but they said, no, I'm not right. I want to go to the hospital and do what I do. Yeah, what do you have to do? CT scan. CT scan? Yes. Just no, right? Just no, all the time, it's just no. What do you call it? Huh? You do? I talk to my sister. You're in no trouble, don't worry. I just explaining to them what's going on. Yeah. So, I'm down in the yard again. I 2 ambulances that came. It wasn't to go to Morrissey to carry me. So I have to wait on the right ambulance. The COVID ambulance that comes for me. So I'm here in the yard waiting. But the cold breeze is so nice. Yeah. Just overlooking the Atlantic Ocean, the seawall. So I'm relaxing here and trying to saturate the oximeter. So for at least see if my oxygen don't talking.
Wendy, your closing remarks, please. Your sister gone, neglected.
Yeah,
Your closing
neglected.
remarks. Yep.
We're just asking and begging and pleading if they can improve on the standards, if the Minister of Health can look into it, and the persons that trickle down under him, can they come together and do something and save lives? When you go into a hospital, it's to get help, not for you to come out on a stretcher cold. You know, we are expecting our sister, my sister, and for her to come out and for us to be happy and talk again. I used to talk to my sister every day, all day, in the shower, in the bathroom, and we would laugh. She said, "Don't tell me you were in the toilet." You know, I miss her. I miss her the couple days, 11 days she was hospitalized. I miss her. And then for the rest of it, I don't know what's going to happen, you know, but I'm begging and asking the installed government, the regime, if they can come together and talk about and look into it and try to get better help to these people.
They need it. They need lots and lots of help. Wendy, they
A
need
lot.
it. My heart bleeds for you and your entire family at this time. Let's go to the closing remarks of Melissa, a niece. Go ahead.
To the minister, Frank Anthony, I think you should invest in competent doctors and nurses, because a few of the doctors there and nurses have no idea what they're doing. You should also invest in dietitians. This is very important. Dietitians, because they had a couple, not a couple, but all the time, like they were given diabetic patients,
Regular.
patients with high blood pressure. Everybody were getting the same food. That's ridiculous. That's ridiculous. So you should invest in dietitians, okay, and physiotherapists. If you can't have patients laying in bed all day with no movement. They need to get up. They need to move. They need to exercise to the best of their ability, or to what their body can tolerate. Okay, so you need to invest in those things and look into the situation so that it can never ever happen again. We know that's not going to be tomorrow anytime soon, but you know just look into it and try your best to improve the situation there.
I don't know how that's going to happen, especially under uh, those guys who are there. Um, it is just sad. I don't know how that is going to happen. I hope that take him off the screen, man. Kizzy, your closing remarks, please.
It's actually absurd when you listen to the last voice note that you just played, and the male nurse is asking her, "Who are you on the phone with?" Why is a healthcare worker concerned about who a patient is talking to, unless you know that you're not meeting the standards of this patient's needs and you're falling short of your job, your role, your responsibilities to ensure that the patient is appropriately cared for. So that was something that really kind of stood out to me, that he was so concerned about who she was talking to, and then her having to assure him, "Oh, don't worry, I'm talking to my sister. You're not in trouble." I think people should pay attention to that because it kind of paints a picture and sets the tone for the environment of that facility. And perhaps even to some degree, the level of fear and concern and worry that some of the patients were in, that they felt the need to somewhat have to protect the staff there, the incompetent staff there. And I do agree with my cousin as far as making sure that, and I'll go a step further and say not only these COVID facilities, but all the medical facilities in Guyana, you do need to invest in competent doctors and nurses and have physiotherapists and dietitians. I mean, why are you giving a diabetic patient regular food? Why isn't there distinguished diets for patients based on their medical conditions? There should be regular, diabetic, mechanical soft, pureed, liquid diets, and the appropriate diet should be given to the patient based on the medical condition that they're presenting with and whatever additional underlying medical conditions that they have. So the level of gross neglect and incompetence, it's through the roof. And hopefully, again, I'm hoping that this stream will meet the ears of the people that are the decision makers in the healthcare industry in Guyana, and hopefully some positive change can come about from this.
Once again, condolences to your entire family and the passing of this beautiful woman who would have contributed in the healthcare sector for many years. She saved lots and lots of lives, and I'm sure she delivered lots and lots of babies as well. May her soul rest in peace. Vanessa Maynard, condolences again to the entire family. This is such a sad situation, a shame and a disgrace what's happening in Guyana.